Looking to improve the conditions of the broken healthcare system, last March, President Obama signed his comprehensive health legislation into law. But even though the implementation of this reform is underway, it is still in danger.
Obviously, with the new Congress, there's going to be a lot of effort to take a look at the healthcare reform bill, either make some changes or in some people are talking about just completely getting rid of it. So what's happening with the healthcare reform bill itself, we're still working. Work is still ongoing as planned.
According to Dr. Castro, even though people would benefit from being able to get insurance regardless of any pre-existing conditions, coverage would be extended to young adults, and subsidies would make health premiums affordable, among other provisions. People oppose it just to make a stand against government.
It's a matter of principle. Again, there are some people that say federal government shouldn't even be doing this. This is not the role of the federal government, period. That's one argument. Second argument is that the federal government is utilizing taxpayers' monies to provide care for people that should not get the care. I mean, bluntly, that's what the talk is about. And I think that these are the main reasons as to why, even before it's being implemented, to see whether it works or not, people are against it.
According to the U.S. Department of Health and Human Services, without Affordable Care Act protections, in 2014, 1 in 2 non-elderly Americans could be denied coverage or charged more due to a pre-existing condition.
Right now, I have a chronic ulcer. I also have problems with a hernia in my stomach. In my credit history, I already have more than $20,000 on medical expenses because I do not have health care.
And if there is no reform, Dr. Castro predicts that disparities among minority groups will persist and money spent on healthcare will continue to increase.
That is why we have to do these things in the healthcare reform bill, because it's a public emergency. We're having people having strokes and heart attacks, asthma exacerbations, lung disease. We're having elderly people that are not getting the proper care, so as a result, they're becoming more dependent on services that have to be paid by the government or the city or the people. So it's a public health problem. So the purpose is to provide adequate care to our people, and when I say our people, it's Americans, and to keep them more productive.